It's time for TLC at Home. Hey everybody, my name's Rene. Glad to be with you for another week. Well, this will be the final TLC at Home podcast. Not ever, don't panic, but for a while, going to take a little bit of a break during this summer. I'm speaking at some different places. We're taking some vacations, so going to take some time off from the podcast, but we will be back this fall. Hey, I am here alone today. Usually my wife, Lori, co-hosts this, but she is babysitting our grandkids today back at their house. And so I'm all alone here today as I produce the podcast, but not really alone because I'm with you and the Lord is here with me and we've got some great guests via Zoom. I will be talking with Dan Baker, the pastor at TLC who's in charge of our care ministries, and also Heidi Heath Garwood, one of our leaders of our 12-step ministry at church. And I want to talk to them because I have been seeing more and more headlines like this from USA Today. Here's the headline: Deaths of Despair. Coronavirus pandemic could push suicide and drug deaths as high as 150K. Study says it's talking about the social isolation imposed by the coronavirus pandemic and the resulting alcohol and drug overdoses and loneliness and suicidal tendencies and so on. Well, it occurred to me that Twin Lakes Church, really in some ways, every single thing we do is meant to help people through these times of crisis. I mean, literally everything, every Bible study, every sermon, every worship service is helpful in this regard, but we do have some specific ministries related to addiction, related to loneliness, related to mental health and emotional support. And Dan and Heidi are at the forefront of those ministries. So I really wanted to talk to them about how you can be helped if you're feeling lonely or if you're feeling tempted by an obsession or an addiction, whether it's alcohol, drugs, pornography, shopping, anger, or something else. And then secondly, I also wanted to chat with Dana Welley. Dana is both a physician and an attorney. Can you imagine that? 2 doctorates. And she has been conducting testing of COVID-19, in fact, on campus at Twin Lakes Church. And so I wanted to talk to her as a physician about what she has learned about this virus. So she's coming up at the end of the podcast. And I also want to ask, how does her faith in the Lord help her through perhaps some of the anxiety that she might feel? So all of that is coming up this week on TLC at Home. Hope you stay with us. Well, first I want to jump into my Zoom conversation with Pastor Dan Baker and Heidi Heath Garwood. Again, Dan is the leader of our care ministries at Twin Lakes Church, and Heidi Heath Garwood is one of the leaders of our 12-step program. So here's my conversation with Dan and Heidi. First of all, Heidi, what's your own story? How did you wind up in the 12-step ministry at Twin Lakes Church?
First I want to say I'm grateful that actually Sunday I celebrated 5,844 days of sobriety, which happens to be 16 years. It's my 16-year sobriety birthday on Sunday.
Wow.
So,
congratulations.
Yeah. And yeah, it's amazing. I still am surprised at the fact that I'm still sober. I know it sounds kind of crazy, but surprised by the fact that I've been able to do it this long and that I didn't get sober till my 50th birthday.
Wow.
And so it's and just bottom line, I tried for many, many years to get sober and I could not do it alone. And when I finally turned it over, I actually asked God to, I prayed for him to lift my obsession, but he didn't, because I really didn't want to stop drinking. I wanted to keep drinking and still be connected to him, but that's not possible. I know now that drinking is separation from God, and until I truly turned it over to him was when he lifted the obsession. I count my days still because it is a daily thing. We, in the program, we talk about that we have a daily reprieve based on our spiritual condition, which means that I have to do this every single day. Every single day. My husband makes me a little number that I carry in my pocket that says the day of the numbers of days I have sober. And it's our shared vision and view of the future together. And one of my biggest stories that came out of my sobriety was speaking in church after you, Rene, asked me to speak live in church when I was about 4 years sober. And I'm sorry I get emotional about it because it's the most important thing that came out of my sobriety is that my husband came to church to hear me speak on sobriety. And he wasn't an atheist, but he didn't get the Jesus part. So he came to hear me speak in church. And the third time I came off the stage, I saw something different in Dick's eyes. And I found out a couple of days later that it was Jesus. Jesus had healed him. I thought that whole thing was about me and my sobriety, my message, and it was about God using me and my sobriety to get Dick there. It was amazing. I'm sorry, I'm getting emotional thinking and talking about it. I always do.
It's worth being emotional about. And that's a great reminder that our sobriety is not just about us.
No, it's about service. And to me, people ask me daily, like, I've been sober 16 years. Why are you still going to these meetings? And I have to say to them, it's about being available to God to be used. And it's about service and how I can show up. And like the Holy Spirit works, you come alongside others who have been through, I've been through what they're going through, and that I can like stand by them and say, look, you can do this too. It's not, if I can do it, you can do it. And point them to God, and God does the transformation.
Well, let's talk about that transformation. I have a few questions for you. I've been reading that people are sliding into relapse during this whole coronavirus crisis. What do you, as someone associated with our 12-step group here, have to say, first of all, people who have relapsed?
Well, I first I want to say I understand, I get it. Drinking was my coping mechanism too. It's not an option for me anymore because I've put other behaviors in place to turn to. I understand how hard it is, and I want to encourage you to, well, first of all, join us we have 2 recovery meetings at Twin Lakes, one on Monday night, which is what we call an open meeting, which means it's for alcoholics and addicts, and also those who support those people. That actually be, it would be Al-Anon people who would actually go to Al-Anon, who have people they're supporting in addiction and how they cope too. So it's an interesting shared meeting that we do on Monday nights, and we've recently gone to a live version. You guys Twin Lakes has been unbelievably supportive in allowing us to meet in live 6 feet apart in the parking lot on Monday at 7:00. And it has been fabulous because the connection part is everything in recovery. It's everything. The connection to others and shared stories and hearing each other talk about their recovery. It's so powerful. One of the hardest things to do is walk into a room of recovery and say, I have a problem. I have a problem and I need help.
I met somebody on a Zoom meeting who has just begun attending Twin Lakes Church virtually. And he told me that the reason he liked the church and found out about the church is because he began attending the virtual 12-step meeting
Hmm.
on Monday night. That was his entry into the church. And he said he was too afraid to come in person. And
That's
so he began his 12-step life virtually through your Monday night group.
I'm so amazed that that's happening. And yes, there's been several young people, even young people who've come in through recommendations of pastors, and I watch them just see us talk to each other and tell our stories, and they've been able to like glean some hope there. And it's our 12-step meetings are a little different than normal AA meetings in that we talk about Jesus and as our higher power. And some people coming into the Zoom meetings now feel a little funny about about that coming from a church setting. Well, I've been a Christian since I was 9 years old. Well, I was still an alcoholic.
Right.
And so this disease doesn't discriminate. It's like I said, it's based on a very strong connection with God and surrendering, because we can't do it alone. We just can't.
And once again, they're Monday nights at 7. You're doing them live in person with all the social safety protocols in place. Heidi, are you also doing them virtually or only live or in person right now?
No, we're doing a Thursday meeting on Zoom, and if you are interested, you can go on the TLC website and go to adult support groups, and under that is 12-step recovery on Thursday night. You can email me and I will put you on our Zoom link, so you get an automatic Zoom link before on Thursday. Like I'm going to send one out shortly for our Zoom meeting tonight. And what happens is you just join us. You don't even have to put your face on there. You can just listen in if you want for the first couple of times. Yeah.
So Heidi, do you mind giving us your email address if people want more information about any of this?
Sure. It's Heidi, HEIDI and it's heathdesign.com. It's Heath like the candy bar, HEATHDESIGN.com.
Heidi at heathdesign.com. Thank you so much for what you do.
Can I tell you one more story?
I hope you would.
Just real quick, I want to say that speak to the people who are supporting people who they find don't know what to do, and they don't, they have no power over this whole someone who's drinking or in addiction. And I just want to say that's one of the hardest things to do, is watch someone active in their disease. First, I just want to tell you, early in my sobriety, when I was sponsoring women, one of my sponsees had relapsed, and I just was devastated. And I went to my sponsor and I said, what, there must have been something I could have done. I like I didn't do it right. And so my sponsor said, Heidi, you're not that powerful. And so I just want those people to know, it's all you can do is take care of yourself and pray for that person, lead them to the recovery meetings. And like I said, take care of yourself, and don't try not to obsess on what to do for them. Point them to God and point them to our meetings.
That is so good, Heidi. Thank you so much. And I want to pivot over to Dan, but Heidi, stay on the call if you don't mind. Dan, as pastor of care ministries at the church and also senior ministries, you have supervised all kinds of mental health and spiritual care initiatives like our annual mental health conference, which unfortunately this year can't take place in person because of the COVID crisis, but there's all sorts of other support that people can get at Twin Lakes. Why don't you tell us a little bit about some of the ways that people who are feeling lonely, people who are feeling anxious, people who may be looking for mental health resources might be able to find some connections through TLC.
It's really amazing the number of folks that are committed to caring for people. We have a visitation team that, presently not visiting in person. Some of them are doing like social distancing walks with people and that sort of thing. But visitation team that visits a lot of shut-ins. These are people that are very lonely, many of them. We have a grief share support group that normally runs during the fall season and the winter and spring seasons. But this summer, we actually have a summer grief chat going on, led by a professional grief counselor. We have mental health support groups as well. I should mention also, suicide is something we're all very concerned about during this crisis, this coronavirus crisis. And there's a great suicide hotline. If you are a person who is thinking about suicide, I urge you to call the suicide hotline, area code 831-458-5300.
Can you repeat that for us?
831-458-5300. We also have a Sunshine Ministry team, which provides meals for people that have just gotten out of the hospital or have some physical illnesses. And we are back to providing home-cooked hot meals, as well as they call them freezer meals that you can take and thaw out and heat up for yourself. It's an amazing team of about 75 people that are doing this regularly. But also we have Stephen Ministry, people who come along one-on-one with people that may be going through a period of grief, or maybe had a divorce, or have an illness like cancer. Maybe they were in the hospital for a while, or are in the hospital, or chronic illness, or job loss of home. There are many things, different kinds of crises that a Stephen minister will come alongside this person. And Stephen ministers are not counselors. They're not trained therapists. They're not there to give medical advice or legal advice. They are there to encourage, to listen, and to point them to the Lord. And our Stephen ministers primarily are using the telephone or something like Zoom right now, but there are those that are comfortable with it, not only the Stephen minister, but the care receiver themselves, practicing social distancing with masks and so on, going on walks with their care receivers. But it's an amazing ministry. And all of these ministries, we're always looking for new recruits.
How can people get information about that, about either volunteering or maybe connecting with it, Stephen Minister?
Email Carrie Clark at care, C-A-R-E, at tlc.org.
And Dan, many of the other things that you mentioned are on our website at tlc.org/help. Thank you both so much for your ministry. If anybody listening is feeling lonely or discouraged or depressed or tempted, we are here for you. All right. Thank you, guys. Thank you, Heidi. Thank you, Dan. God bless you. Have a great day.
Thank you, Rene.
Thanks, Rene.
That's Pastor Dan Baker and Heidi Heath Garwood. And now here's my conversation with Dr. Dana Welley. Dana is both a physician and an attorney. What has she learned about this virus? What would she like the general public to know? How can we get accurate information about this thing? And then finally, how does her faith help her through all the anxiety that maybe even she encounters as she deals with the reality of COVID-19? So here's my Zoom conversation with Dr. Dana Welley. Well, Dana, thanks for being with us. You've been overseeing the COVID-19 testing at Twin Lakes Church. You're also a member at the church. Great to have you here.
Thank you, Rene. It's nice to be here.
Dana, tell us a little bit about your own professional background.
Well, for those of you that know me, I've had a very different trajectory. I was a physician in the community. I was honored to take care of the women in the community for over 12 years as an obstetrician gynecologist. I switched career paths and went back to school and got a law degree from Santa Clara University. And then I was working up at Stanford Hospital for almost 8 years in a very clinically, in a clinical capacity. I wasn't seeing patients, but I was doing all of their risk management services for the physicians. And through my work at Stanford, I was asked to do some consulting work in the infertility space for a company in San Francisco. And we were working on some wonderful medical devices related to breast cancer, infertility, and HIV. And along came COVID in March of 2019. Actually, I mean, that's when we were really starting to deal with it. And our company's CEO, rather than furloughing everybody, asked the folks that were working on different projects if they would be interested in pivoting and addressing the COVID crisis. And it was really a way for the whole company. And it was wonderful because we didn't end up having to lay anybody off. And people who from all different walks within the company came to address the COVID crisis. And since we were already in the infectious disease space with HIV, we were able to pivot some of that work and HIV over into the COVID infectious disease testing.
Tell us about this testing that you're doing then. Go into a little bit more detail about the technology that you're using.
Sure. So the antibody testing, and there's really two different types of tests, and many folks will hear the viral testing, infectious testing, antibody testing, immunity testing. But really, when you're talking about COVID testing, there's really two big buckets. One of them is viral testing for the active disease, and one of the other bucket is antibody testing for any previous exposure. And so what we did at Twin Lakes is brought to the community the viral testing for the active disease. And for the most part, that testing is pretty consistent across the nation. When COVID first hit the communities, we saw lots of pictures of people, in lines with their cars, hazmat suits happening, and they were doing a viral testing called the nasopharyngeal swab, where a nurse would actually, or a healthcare provider would actually stick a very long Q-tip back all the way through the nasal passages, very uncomfortable testing. And that initially was the only way we knew how to test. There was a lot of work being done in Washington State around modes of testing, and they quickly realized that in addition to the nasopharyngeal test, that the anterior nares, or the front of the nose, was actually a very good place to pick up the virus. And that was a lot more comfortable for patients. It was actually able to be self-administered. So that meant less exposure for the healthcare providers. It really seemed like a win-win for both the patient and the healthcare providers doing the testing. And as we were ramping up to start doing testing, we decided that it would be best to bring the communities the anterior nares testing, which is what we were indeed doing at Twin Lakes. And it is a PCR test. It looks for the active virus anywhere that it would be. And most of the times it's in the nasal cavities. It can be anywhere, in the respiratory system. But for patients, being able to test the front of the nose has been a really wonderful turnaround for us.
How's the response been to the test?
Fantastic. People really want to be tested. And I found, anytime we start talking to people about testing, there's a lot of confusion. Should I be tested? Should I not be tested? And some of that confusion comes, I think, because when we first had our outbreaks and there was such a limited supply of materials, the CDC was very clear about stratifying testing based on need. And so you would see from the CDC, here's our folks that need to be tested. And it wasn't that everybody shouldn't be tested. It was we only had the manpower or the supplies to test people in a certain cadence. So the general population wasn't learning about testing. They didn't know how to get testing. And as more and more supplies become available, we're able to expand testing, and we're not even near where we should be yet.
The county has been saying on their website that they want everyone in our county tested. They're offering free testing in Watsonville at Ramsey Park. That's that long Q-tip back into the sinuses. Your group's doing it. Presumably other people are going to get on board as well. But why? Why get tested? Why especially when you're not symptomatic?
That's really, I think really that's two questions. So the reason to be tested is in order to track the disease, to understand where the disease is going. You'll hear words like contact tracing. The Harvard Health Initiative is saying we should be doing 1.9 million tests nationally in order to understand the disease and its progress and how we might, do tactics like social distancing. And the only way to understand the prevalence in the community is to do the testing. And what we've learned as the disease has progressed, or as our understanding of the disease has progressed, to your second point, is why test asymptomatic individuals? Because they can shed the virus. So we were really fortunate yesterday, for example, we had a group of young kids come in, all over 18, because you had to be over 18 to test, who were very concerned because one of their friends had tested positive. So it was really wonderful to see these kids in our community saying, gosh, I think I've been exposed. I don't feel bad, but I want to make sure that I don't, expose one of my vulnerable parents or someone that I'm close to that might be more at risk to get very sick from the disease.
As a physician, is there anything that you sometimes wish you could explain to people or could make clear kind of to the general public that maybe but that you feel like people are maybe misinformed about or misunderstand?
It's probably more of a misunderstand. So, with lots of things in medicine, prevention, an ounce of prevention, my grandmother told me, is worth a pound of cure. And right now, especially with this virus, the best thing that we have for preventing the spread is social distancing, washing your hands, and wearing face masks. It's three things that we can be doing as citizens of our community that will really help with this pandemic. And it's concerning to me when people don't want to take preventative steps to help themselves, help those around them. We're now conditioned within the medical community, to get your flu shots, to get your mammograms, to get your colonoscopies. Those are all things that we do as citizens of the community to prevent disease for ourselves. Now we have an opportunity to help prevent a disease spread. And it's very simple, wear a mask, wash your hands, and stay away.
Talk to me about the importance of wearing masks. I'm not sure exactly why. Probably years from now, some graduate student is going to do a paper on how face mask wearing became political in 2020, but it did somehow.
Sure, it did.
And so tell me about the importance of wearing masks from your perspective.
Well, I can tell you where, in my career, where mask wearing came from. I used to wear a mask every time I did a surgery. And the reason I wore my mask was because in surgery, there's conversation. There's lots of chance to infect a patient. And I was wearing a mask. Number one, it would prevent any fluids from hitting my face, but it also prevented me from expressing my fluids into the patient. So it makes a lot of sense to be wearing something that will protect me from, my breath and my potential exposure to you. It's not, initially when the mask thing came out, there was a lot of discussion of, well, masks don't work. If I'm Dana Welley and wearing a mask and you, Rene, are talking to me, I'm not going to be protected from you, Rene. Rene, the only way you're going to be able to protect me is you too wear a mask. So a simple way to test that theory is if you take a birthday candle or some type of candle and blow it out, if you put a mask on, you can't blow that candle out. So that means I can't get my germs that far onto the next person. So that's why it's really important to wear a mask.
Is there anything else that you want to get across to people who are listening?
Staying informed. And when I say informed, the news, and Rene, you mentioned how this has somewhat been politicized. I think there's been an opportunity or a lot of fear has been created in the community. You see a lot of reports. I mean, this is classic with most news where they give you this little snippet and they slightly refer to the CDC. I encourage people before they get concerned. The CDC, the FDA, WHO has a lot of really good, accurate information that is understandable. So as these news things are coming out, before anybody panics, they should take a moment, take a breath, pray, and then go and look at the actual references. I'd also say, I have an elderly parent, and he is glued to the television. It's creating a lot of anxiety. And I've, just for his own mental health, I've said, Dad, you need to back away, you need to take a step off and just go outside for a walk. So sometimes just turning off the noise is really a good way to deal with the anxiety, and of course, pray. I mean, this is, I found myself one day, there was something going on in the news. It was almost overwhelming. And I walked outside and I just had to remind myself that God is in control and he has a plan. And knowing that as a Christian, there's so many things we don't know, but to know that God does know and he has a plan for us and he loves us has been one of the best ways I can say that I've found some peace through all of this.
I want to get back to that and your faith. But first, I want to reemphasize what you just said about the CDC website. When my wife, Lori, and I came in for testing, we, with you and your group, and we were talking about this, you said if there's a one-stop place, kind of like one website bookmark for people to go to, it would be the CDC website.
You have to have the whole context of the whole report that's going on and what does that mean in the bigger picture to really understand it.
Let's get back to your faith, kind of as our last question here. You're a Christian, not only a professional doctor and lawyer. How do you approach this as a believer in Jesus, in the Bible? You mentioned God's sovereignty over everything. What does that faith bring to this for you?
It really brings me peace in the chaos. I mean, it's, one of the things I've learned as a type A personality is that I have to scale back on is relying on myself. I have to give up and rely on God because there's so many things I can't answer. And if the experts, and I'm not saying me as an expert, but there's people who know way more about this than I do, and I know they can't answer it either. So that ultimately means God has to answer this. And I know we might not know the answers immediately, but I have to trust his timing. I have to trust his sovereignty, his timing, and just have faith that he has a plan for us. There's a lot that's been going on in our society. There's a lot that's been very, very unsettling to many people for many different reasons. But I know a few things for sure. I know that God loves me. I know that I'm saved, and I know that he has a plan for me. And if I focus on those three things, no matter what is going on in my profession or my family, and I remind myself of those three things, it really gives me a sense of peace to move forward. I think it's really important to remember that God has given us the ability to understand and research and investigate. But at the end of the day, we're never going to know the answer to everything. So there has to be faith in there somewhere to trust that God will carry us through and provide us with the answers in the direction that we need.
Amen. Well, I couldn't wrap it up any better than that. Thanks for joining us on TLC at Home. My name is Rene Schlepfer, one of the pastors at Twin Lakes Church. We really appreciate your support of the church and your engagement with these podcasts. This is our last podcast for the summer. We'll be back in the fall, but you can get daily devos, kind of like a daily little short video podcast every morning, Monday through Friday at 7 a.m. You can get those texted to you. And you can subscribe by texting TLC to 41411. That's TLC to 41411. God bless you. Hope you have a wonderful summer. Remember, keep your eyes on Jesus and not the storm around you, and you are going to be okay. God bless you. See you next time on TLC at Home.